Hello everyone, this is Manu Singhal, a medical student. Today I am here to do a full eye examination for the OSCE purpose. So before start the examination, I would reconfirm your name and age. What's your name and age?
My name is Kumar Narendra. My age is 22.
Okay, so my first examination in which I observe your visual acuity through the distance. So let's start the examination. So moving forward to our first examination, which is distant visual acuity examination. In this examination, we ask the patient to read out the letters which is 20 meter from the patient eye by covering one eye and read out from top to bottom. Okay, can you please read out these letters which is there from top to bottom by covering one eye?
E, F, A, B, C, E, H.
Okay. Now we repeat the same procedure with another eye also. Now the second examination is near visual acuity examination. In this we repeat the same procedure that by asking the patient to cover one eye and read out the letters which is distant around 30 centimeter from the patient eye. So can you please read out these letters from top to bottom by covering one eye? Can you please cover one eye?
Yeah.
It's comfortably, not put the pressure.
Kathy, delete, pillow, bedsheet,
Okay,
cake, Colgate.
fine. And we repeat this procedure with the another eye also. So my next examination is a refraction test. In this test we use a pinhole examination. In this we use a card having the pinhole and ask the patient to read out the same letters from top to bottom. If the visual acuity is improved, then there might be a refraction issues. So can you please see the same letters from top to bottom by this pinhole in this card, but first also cover the one eye. Okay, can you please put and cover the one eye and see the letters. Now read out from top to bottom.
E, F, C, D, E, F, G, H, E, A,
Okay.
B.
Okay. And we also repeat the same procedure with another eye. The third examination. In this examination, I which called as extraocular muscle examination. In this, I observe the patient eye muscles or alignment of muscles of eye. In this examination, I ask the patient to see the tip of my pen and follow the tip of the pen without moving your neck. Okay. In this examination, we observe also observe the patient eye having any lid lag or not, and also observe the cranial nerve 3, 4, and 6. Now moving the next examination, in which we the cover and uncovered examination. In this examination, we ask the patient to cover one eye and then we see the alignment of another eye, or there is any movement in another eye by covering one eye. So can you please see over there? Okay, now I cover the one eye a little bit toward me. Okay, and if there is any lag in the eye, or is there any adjustment by another eye by covering one eye, we can see that there is no lid lag and there is also no misleading in another eye. And we also proceed same procedure with another eye. Now the next examination is external or gross examination. In this we observe the patient eyebrow for any symmetry or asymmetry, any masses, edema. So in this we also observe the palpebral fissure is present or not. Okay. So both eyebrows are aligned. There is no edema seen and no inflammation also. Moving toward the next examination, in which we observe the conjunctiva of the patient. In this we ask the patient to look up and down, and we see any inflammation or any edema in the conjunctiva is present or not. So can you please look upward? Now downward. Okay, so there is a no inflammation or edema seen in the conjunctiva. So the next examination is direct and consensual light reflex. In this examination, I flash the light on the one eye of the patient and observe the pupillary constriction in another eye. So and repeat the procedure with same procedure with other eye also. So next examination is visual field testing and confrontation test. In this examination, we examine the range of eye of a patient by asking the patient when they see the fingers. So in this examination, I use my both hand, and when you see my fingers, just tell me to stop. Okay.
Stop.
Okay.
Stop.
Okay.
Stop.
Okay.
Stop.
In this examination, we observe that the patient's visual field is normal. So our last examination is fundoscopy examination. In this examination, I use my ophthalmoscope to examine the patient eye and to see the fundus of the patient. For any abnormalities in the optic disc, including its size, shape, and color. Okay, and also repeat the same procedure with another eye.